think I knew at the time that chances are it was prostate cancer, but didn't really take it on, if you see what I mean. And the oncologist basically said, you know, we think you've got, we know you've got prostate cancer, and I just basically went, just buckled. And then the sort of like meeting stopped. I felt like a bit of a fool really, but that's just the way it is.
But I actually got the letter saying you've got stage 3 prostate cancer. I got that through the post before I'd actually gone for the appointment with the consultant. That was a bit surprising. God, how can they sort it? Can they fix it? Can I be treated? And then what's the treatment going to be like? What's that going to mean for my quality of life? So there's lots of stuff goes around in your head.
But what was interesting, what was funny in fact, was the urologist came in afterwards and he says, "Oh, what's going on here then, Mr. Reid? And let me have a look at your biopsy and the scan." And he said, "Nothing to worry about at all." And just like in a very blasé sort of way. And I thought, well, if you haven't got a problem, then why am I worrying about this? It might be nothing, and if it is something, it's treatable. And I said, you know, is this going to kill me? He said, no, you'll die of something else. It won't kill you. You'll be fine. I think that for me meant a hell of a lot, because I'm thinking, well, look, you're the expert here. You don't have to say that. And once you've said that, well, I feel fairly confident that I'll be okay. My name's Des Reid. I'm 67 years old. I'm married to Joan. We have between us 2 boys and a girl. Before I was diagnosed with prostate cancer, I didn't really know much about it. Joan is a very good researcher, and she's very good at that. So I'd say that we'd done it together. She'd done basically the majority of the research, and I'm saying, well, yeah, that sounds good. And at first we said, oh, if you can just take the prostate out, all well and good, take it out and that's it. But then after looking at some of the side effects, thought twice about it, and I thought at such an early stage, I didn't think it was the best for me. And we looked at the others and we came to the decision that HIFU would be the best treatment, because the side effects are not as bad.
I'm Alec. I'm nearly 70 years old. I will be in a week's time. I live in Bramhall, which is just a little bit south of Manchester, with my wife Nikki. We're a second marriage, and between us we've got 5 children, but they're all grown up, and thankfully. I retired about 4 years ago. I used to work in financial services and thoroughly enjoy being retired. Nikki can't do this, but I can compartmentalise. So I think about it, moan and groan about it, and then put the lid on the box. And I can put it to one side. Nikki can't. She'll think away about it. Sometimes she'll say, I said, "Morning, how did you sleep?" Not very well. I've been up in the night thinking about this, or thinking about you, and thinking about the cancer, and yeah. But I'm quite lucky. I've always been able to, I say, put things to one side, have a think about it, but then move on. Before I was diagnosed, I didn't know that much about prostate cancer. I'd heard of occasionally odd people at work that might have been tested for it or had an example that they'd got it. But I think I only knew one person before I was diagnosed. Well, it was a long time ago. It probably was about 15 years ago. So he had quite radical surgery. And I remember going to see him when he was recovering, and he's sitting on a rubber cushion and he's not very continent, and yeah, it wasn't a good story. I know surgery's moved on a lot. They use robotics. It's a lot more accurate now. But seeing him sitting on a rubber cushion, half incontinent, that put me off surgery, yeah.
My brother was diagnosed with prostate cancer, and he told my son to tell all the other siblings to get themselves tested. And I got tested. I made an appointment the following day. What happened was I had the PSA test and it came back and it was 1.9, so that was pretty good for my age at the time. But for me, I think I was quite lucky because I told her that it was in the family. And she must have made a note on my file to say that my brother was diagnosed with prostate cancer. 3 years later, when my PSA level went from 1.9 to 3.7, although 3.7 isn't that high, they said, oh, it runs in the family, so we think you should get an MRI scan. So I had an MRI scan. I thought, me, MRI scan? I don't think so, Des. But, you know, I almost didn't have it because I thought I had no symptoms, no nothing. So I thought, but if they say I should have it, I'll get it. So I did.
So the PSA stands for Prostate Specific Antigen, and it's a protein that's produced by the prostate. Any man who has a prostate will produce PSA. And it's important to note that healthy prostate cells, as well as prostate cancer cells, will both produce PSA. There's a number of factors that can influence the PSA value. For instance, as men get older, their prostates will naturally get bigger. And that's really common, and you might see that your PSA value might increase slightly. There are other things that can temporarily increase the PSA, such as vigorous exercise or ejaculation. And that's just temporary, and there's no need for men to be concerned about that. So the 3 main risk factors for prostate cancer is if a man is over the age of 50, if they have a family history, or if they are a black man. So if your father or brother has prostate cancer, then you have a 2.5 times more likely risk of developing prostate cancer. And that's what we mean by family history. We also know that if you have any other members of your family that have prostate cancer, that does increase your risk, and particularly if they have prostate cancer that's been diagnosed prior to them being 60.
We come from a long line of heart attacks and strokes. Never ever entered my head that I would get prostate cancer. I was diagnosed with heart disease when I was 50 and had a couple of stents fitted and never thought anything further. Yeah.
My gut feeling was, this ain't happening to me. My gut feeling was, you know, you're absolutely fine, Des, you're fit, and surely if you have prostate cancer, then you'd feel something. And I didn't feel anything at all. There were no signs whatsoever, nothing at all. My health was absolutely fine. One of the symptoms for prostate cancer is getting up in the night, having a wee 2 or 3 times. I can go all day without having a wee. I can go all day now without having a wee.
So most men with early stage prostate cancers won't have any symptoms, and that's why it's really important for men to understand their risk of prostate cancer. There are, however, very common non-cancerous conditions, such as enlarged prostates, that can mimic similar symptoms, so similar urinary symptoms. And that's what's really important for men to understand, that actually it might not be a prostate cancer that's causing any changes or any symptoms that they might have. It could be a non-cancerous condition, and that's why we ask men to go and speak to their doctor about that. Common symptoms for prostate cancer, so that could be changes in the way that men are weeing, particularly they might have increased urination overnight, they might not be able to empty their bladder properly, they might be feeling like they have a weak flow or different types of kind of flow. They're kind of common urinary symptoms that men might experience. And then say if the prostate cancer has come out of the prostate or has spread further into the body, sometimes men can experience other symptoms, and that might include back, hip or pelvis pain, problems with their erections, or maybe blood in their urine and semen.
One of the first symptoms I had was a bit of discomfort when ejaculating. And you think, oh, that doesn't feel quite right. A little bit of blood visible in semen, in urine. And people often talk about blood in your urine, but not usually in semen. And so it was those 2 things, the discomfort and a little sign of blood, that took me off to the GP. Some
men might be given one treatment option, but quite a few men might be given lots of different options to pick from. And the important thing to know is there's not one right option for men with their treatments. Looking over different side effects for treatments, how the treatments are given, because this can vary quite dramatically, and what might be best that fits in with your life and your family's life as well.
The oncologist who gave me my diagnosis, he says you're at the very early stages, and he gave me perhaps 6 options that I could have. And they're saying basically all these options will work, but what they don't do, they don't tell you what treatment you should have. That's up to you. They say, take this information, do your research, but it's up to you as an individual to sit down and work out what you feel is going to work for you best. When I decided to go for HIFU, I spoke to my oncologist, and he said, because of my age and my fitness level, HIFU would be a good choice for me. What they also tell you is that might not cure it, okay, but if it doesn't cure the cancer, you can have another session in 3, 4, 5 years' time. So for me, I'm thinking to myself, well, that is the best option. You know, it's gone for now. It could come back, but I can live with that. And if I have to have another session of HIFU in 3, 4, 5, 10 years' time, that's all part of the HIFU package.
So HIFU stands for High Intensity Focused Ultrasound, and it's where high intensity ultrasound is used to heat or destroy prostate cancer cells. So some of the pros of HIFU, or High Intensity Focused Ultrasound, is that there sometimes can be less side effects, like urinary or erection problems, compared to other treatments such as surgery, for instance. We do know, however, that we haven't got the longer term data for this, and it might also exclude men. For instance, if they have an enlarged prostate, they might not be able to have HIFU treatment. So we suggest that if that treatment option has been given to you, to speak to your healthcare providers about that.
Treatment hasn't affected my sex life in any way whatsoever. And I laugh about it. The morning after I had the procedure, I woke up and I had an erection, and I just laughed. I said, Joan, it's okay, you know, I don't think we've got anything to worry about. I didn't have any incontinence at all, nothing. I didn't have a side effect on that, nothing. Sometimes I might get up in the night to have a wee, but I'd done that years ago anyway. I mean, you know, a lot of people get up in the night to have a wee. You know, Joan gets up maybe twice sometimes to have a wee. It's not a big deal. The only difference now is that there's about maybe 25% or maybe a bit less of semen now than there used to be, and that is the only difference.
It was a joint decision between myself and Nikki. We thought we'd go for the radiotherapy and the hormone therapy. So you do a lot of reading about it, a lot of Googling, a lot of talking to friends who may have experienced it, and we thought that probably would give me the best chance of a happy life afterwards, with all the sort of mobility and continence issues dealt with. And I was worried about being incontinent, you know, the thought that they might have to take more away, because they don't really know until they get inside as to how much they're going to have to take away. It really focused the mind of, I didn't want to become incontinent. How old would I be then? 63. So yeah, I was still working, still active. You know, we enjoyed tennis and walking, and the last thing I wanted to do was be incontinent. I had hormone therapy for the first 6 months of my treatment, and then they started me on radiotherapy. Quite soon afterwards, this is where I can feel empathy with women who've gone through the menopause, because you start to get hot flushes, night sweats, restless legs. You become emotional. Less so now, but when I was first on it, I could watch a weepy movie and burst into tears. It was really funny. They were funny side effects. It's really quite interesting how rapidly, once you've had hormone therapy, in my case, I think every man is different, but in my case, when you have hormone therapy, it does reduce your sex drive. The chances now of getting an erection are minimal. Don't get erections. But also, I don't miss it or think about it. It's really strange. It's just, yeah, it's not on my mind at all. So my wife and I have come to a sort of compromise agreement where we know, yeah, that's fine. It is what it is. It doesn't have to be sexually physical to build intimacy. It's still possible, just with a kiss and a cuddle and a kind word and snuggled up. It's all possible. Yeah, it doesn't have to be sexually physical. I might just add that if this happened when I was 45 or 50, I might have a different view. But at nearly 70, it's less of an issue.
There's lots of things that will inform your treatment options. One of them is where your prostate cancer is. For instance, if it's located still within the prostate, that's called localized prostate cancer. If it starts to spread to the edges of your prostate, that might be referred to as locally advanced cancer. And if it's spread to other areas of the body, it might be referred to as more advanced prostate cancer. And it's not the only thing that healthcare professionals look at as well. They take in a range of different factors.
When someone hears the word cancer, they panic and they think it's all bad, it's going to be difficult to be treated and stuff. In my mind, with prostate cancer, it's different for everybody, And for me, I don't think I knew then, but if caught early, it can be treated and you can get through it without any problems. With this group, Cancer Don't Let It Win, if someone is diagnosed with prostate cancer, I just felt a lot better because I was chatting to someone who had been through this before, and it just made a massive difference. I think if you can join some sort of group of men who have been diagnosed with prostate cancer, it's helpful.
Yeah, so there's loads of support out there that we speak to for men. For instance, we've got the specialist nurses at Prostate Cancer UK that you can call. You don't have to be a man with prostate cancer, you could be a family or a friend. We're happy to speak to everyone about any kind of issues related to your prostate or any kind of side effects or treatments that you're thinking about that you need some support with. If you have any concerns around any sexual side effects from treatment, we also have our sexual support service which you can contact via our specialist nurses. We also have our volunteer service where we can match you with another man that's had similar treatment, or if you have any questions around prostate cancer, sometimes it's a good idea to speak to a man that has been through the same experience.
Do not be afraid. It's far better to know than pretend and not want to know. You've got to go and have yourself tested. If you are getting up a little bit more in the night, is there a reason for it? But it might just save your life. I can remember sitting in hospital, so I'm stage 3 and treatable. Old chap sitting next to me in a wheelchair who was probably 20 years older than me, and I said, "Oh, you're here for the same thing." I said, how are you getting on? He said, "Well, I'm stage 4. He says, "I took no notice of my wife. I just ignored the fact that I was peeing every few hours and getting up in the night, and now it's incurable." So don't leave it that long. Yeah, get checked out.
I don't feel like a survivor. I hate to use like I'm a cancer survivor. I don't feel that. I feel that I was diagnosed with prostate cancer. I came through it, and I come through it very well. No side effects, no nothing. I do feel like a bit of an imposter.